Hey there, welcome to another episode of Vet Candy Rounds. I'm your host, Dr. Shannon Gregoire. Today, we're diving into the world of dermatology. Let me break it down for you. Vet Candy Rounds is all about interactive case discussions where we want you to join in on the action. We'll be throwing some multiple choice questions your way, so don't hesitate to hit that pause button and share your thoughts. All right, let's get into it. I have a case for you. This is Sugar, an 8-year-old spayed Pomeranian who presents to your clinic with a 5-month history of a progressive crustiness that started on her limbs and then moved up to her face. Check out these images. The referring vet did a DTM culture. So what would be your next step for Sugar? Let's look at our choices. Think about what you would like to do next. Cytology is a great answer, but in this case, they skipped cytology and they did a biopsy, and the results came back as lymphocytic interface dermatitis and pyogranulomatous dermatitis adenitis. So we have 5 months of little to no response to treatment and progressive lesions moving up from the limbs to the muzzle with the DTM negative culture. According to the records, Sugar has had no response to lime sulfur treatment, Simplicef, or terbinafine. Nothing worked and the lesions continued to progress, and now there's a new symptom. Her owner brought her back for a recheck, and Sugar has depigmentation and swelling of the nasal planum. This is a tough case. I think it's time to get a specialist in here to help.
Thank you so much for having me on this Stat Chat. I'm Dr. Ashley Bourgeois. I'm a board-certified veterinary dermatologist and also present cases on social media under the Derm Vet. So something really interesting to note about this case's history is the fact that repetitive diagnostics were done and came back inconclusive. Cytology is something you definitely want to do on all of these cases because secondary infection can pop up at any time and the skin is forever changing. We know that Sugar was getting progressively worse despite several different medications, including antifungals, because the biopsy came back as potentially dermatophytosis, so it wasn't conclusive. Getting inconclusive biopsies can be really frustrating, but it also helps us rule other things out. When we see depigmentation of the nasal planum and such an ulcerative feature to the skin, certainly neoplastic and autoimmune would be 2 categories we'd be very worried about. So the likelihood that this was neoplastic was probably quite low since the biopsy results came back inconclusive. So in this case, we did repeat a cytology. We'll do cytology in almost every dermatology case every time they're in the clinic. And we saw an excessive amount of cocci bacteria. And there was concern of resistance because Sugar had already not responded to several different antibiotics. So when we saw there was a lot of infection, a culture and sensitivity was collected so we could identify exactly which antibiotic should be used to eradicate the infection. And then based on the depigmentation and the severity of the lesions, repeat biopsies were taken. The samples were then sent to a specialized dermatopathologist so we could increase the chances of getting a definitive diagnosis. So the culture and sensitivity results came back with a methicillin-sensitive staph pseudointermedius, and we were able to successfully treat the secondary infection with clindamycin. And we did get a diagnosis on our biopsy results this time. The diagnosis came back as vasculitis or ischemic dermatopathy. So we had a feeling it might be autoimmune, but weren't exactly sure it was going to be vasculitis. So very happy that we biopsied and did several different areas so we could get an answer this time. For the vasculitis, we started pentoxifylline at 20 mg per kg twice a day, and then methylprednisolone at autoimmune doses. Our goal is to taper the methylprednisolone so we can just rely on the pentoxifylline long term because pentoxifylline is very safe and the hallmark treatment for this disease process. I'm happy to report that Sugar is doing really well. She is tapering off her methylprednisolone, and we hope to discontinue that soon and just maintain pentoxifylline lifelong. Her ulcers have healed up, and the owner reports she is much more energetic at home and feeling great. Once we got the diagnosis, we dug a little deeper into the history and did see that Sugar had received vaccinations about 3 months before the lesions occurred. Of course, there were other preventions and medications that were given that time as well. So we don't know for sure the cause of the vasculitis or ischemic dermatopathy, but we will make sure to advise avoiding vaccines in the future, as this can trigger the disease process. If we can't avoid vaccines, we want to minimize them the best that we can. So Sugar's case shows us the importance of repeating tests if the results we get just don't feel right. Biopsies are something that should be taken from several different locations and definitely sent to a specialized dermatopathologist in complicated cases. Vasculitis is not the most common autoimmune disease we see, but it can look like several different things. We usually see the ear tips and the concave portion of the pinnae affected, but you can get diffuse cases like Sugar, where you have ulcerative lesions covering the body or the tip of the tail, the claw folds. So we definitely want to rebiopsy these cases if we just aren't comfortable with the results we have. If you find cases like Sugar's interesting, then I really encourage you to check me out on social media. Follow @TheDermVet. I like to put up diagnostic tips and fun cases that you guys can implement in your clinical practice.
What a great consultation with Dr. Ashley, and that photo of Sugar, amazing recovery. Hey, thanks for tuning in to Vet Candy Rounds. If you like this show, don't forget to tell your friends. Sharing is caring. See you next time.
When you talk to clients about parasites, recommend this parasiticide from Boehringer Ingelheim Animal Health. NexGard Plus is the one you want for one-and-done monthly protection. It prevents heartworm disease, kills fleas and ticks, and treats and controls roundworms and hookworms. Plus, the delicious beef-flavored soft chew is safe for puppies. Use with caution in dogs with a history of seizures or neurologic disorders. Give your clients one-and-done monthly protection with NexGard Plus.